4 things I bet you didn't know about natural hormone replacement. I'm pharmacist Steve Hofford.
This video was sent to me by a follower, so I want to address it. The last point was so far off in left field, I almost don't know where to start. Now, to be clear, I don't know what this person's training is other than they're a pharmacist. So as a pharmacist, you don't have clinical experience, you're not seeing patients, you're putting prescriptions together. That's your wheelhouse. Prescribing them is not, clinical setting is not. So he doesn't have that nuance, which is a very important part of the conversation. It seems as though he may carry a Menopause Society certification. It's a certification, it is not training. It's a multiple choice test, not even an exam. And there's no training that comes with it. There's no manual, it's very self-guided.
And number 4, the delivery route changes everything. Taking estrogen by mouth in the form of a capsule or a pill increases your sex hormone binding globulins, increases your blood pressure, decreases growth hormone, increases your cholesterol, can raise blood pressure, increases your risk of gaining weight, and can actually increase your risk of clotting.
Okay, so let's dig into this claim by claim. He's saying estrogen. He's not differentiating between estradiol and estrogen. So if I'm going to be a stickler for verbiage, we know that estrogen is a blanket term, and it's typically used when referencing conjugated equine estrogens, which do not perform in the body the same way that estradiol does. So if these claims are being made on estrogen, then yes, a lot of them are correct. So conjugated equine estrogens will raise your sex hormone binding globulin pretty significantly. Estradiol doesn't really move that needle all that much. You might see with an oral formulation that it does ever so slightly. So nothing significant. Estrogen, conjugated equine estrogens, yes, those can raise your blood pressure. If I am taking an oral micronized estradiol, it is not going to raise my blood pressure, not even in the slightest. That's not what it does. It's a completely different compound. Fun fact, we actually see improved endothelial function with oral micronized estradiols. You're not going to end up with hypertension. It's not a thing. Okay, next one is growth hormone. Oral micronized estradiol is going to support your IGF-1. Conjugated equine estrogens are not. Therefore, you are not going to see a decrease in growth hormone with oral micronized estradiol. That's not how it works. It supports IGF-1. Estrogen will. So when he's throwing out the term estrogen, he's being accurate. Absolutely, except for he's referencing estradiol at the beginning of his TikTok. Is really crossing back and forth between the two, which is confusing for women in the menopause space. Now we're talking about cholesterol. So he's saying that estradiol raises cholesterol. He's actually saying estrogen does. So if, because context is key, we are saying estrogen does, that's one thing. But I don't know who's out there prescribing these ethyl estrogens, these conjugated equine estrogens, because we shouldn't be using those when we have oral micronized estradiol. If we're looking at cholesterol markers with estradiol, all of the studies show this, and it's not transdermal patches either. It's oral micronized estradiol that has the most impact on lowering your LDL, raising your HDL, which is what we want, lowering triglycerides, lowering ApoB, really hitting home those cholesterol markers, your lipid profile, in a way that is more beneficial than anything else there on the market, including statins, which, by the way, ladies, if you have not got a pre-existing cardiovascular episode, no heart attack, nothing, you shouldn't be on a statin because they don't offer primary disease prevention, only secondary. So that's some food for thought. Okay, now we're also inferring in his video that estradiol or estrogen causes clots. So again, when it comes to increased clotting factor, when it increased risk of clotting comes into play, that's with estrogen, not the estradiol form. So oral micronized estradiol does not increase your risk of clots. There is not one study that shows this. And I have continually challenged other clinicians in this space to show me the study. Show me the study. Show me the study. Nobody can. Any study that they present, well, here, look, that's estrogen. Well, yeah, but what about this one? Conjugated estrogen. Estrogen is not estradiol. Not one single study shows an increased risk for clots with oral micronized estradiol. Period.
But using natural estrogen transdermally or vaginally can improve your cardiovascular protection, lower your risk of stroke, and improve your blood pressure.
I have to chuckle because vaginal estradiol is not systemic. That's why it is deemed safe to use if you have a history of breast cancer. I'm not saying that other hormones aren't safe to use. That's a whole other video. But for the fact of the systemic versus non-systemic, vaginal estradiol, when used in creams and suppositories, isn't in a dose that's high enough to be systemic. Now we'll talk about transdermal, like patches and such. I really wish people would read the studies, read the literature, look at what the dose is that's required to do each and every single thing, how that was administered. Was it a patch? Was it transdermal? Was it a cream? Was it oral? What was the dose? Did we need an increased dose to reach this therapeutic level to get this protection versus that protection? The data is very clear. So since we don't have that first pass effect from either one of those, including transdermal, we know that there's no cardiovascular benefit. It's cardio neutral if you're using a patch. That's neutral, means not bad, not good, neutral. It's no cardiovascular protection. It is not reversing plaque. You're not getting cardiovascular benefit. And then we look at other things like dementia. We look at bones, bone health. So, you can Google osteoclast versus osteoblast. The whole goal of estradiol therapy when it comes to bone health is to not just prevent the loss of bone as we age. We want to stop it completely, but we also want to be able to regrow bone when necessary. So there are some things that will slow down the loss of bone. Transdermal does help with that, slows it down, doesn't stop it completely. Oral micronized stops it in its tracks and will regrow bone, especially when combined with testosterone. If it's combined with testosterone, there's different types of bone that you're regrowing. I've done posts on Substack about this that are very detailed. It is impressive what hormone therapy can do. So I'm not saying not to use the creams or not to use the patches. Actually, no, I am saying not to use the patches. The patches are absolute garbage. Throw them in the trash where they belong. Go for an oral micronized estradiol. That's your best option. And tag in a vaginal cream of estradiol for the symptoms of GSM. So urinary incontinence, frequent UTIs, when you feel that sensation of, I have to go to the bathroom, but I just went to pee. What is going on? Things like that. Pain with intimacy, vaginal atrophy, thinning of the tissue, all of that. Absolutely. And you can use the cream and the oral together. I'm so tired of seeing patients who are told it's one or the other, you can't have both. Vaginal estradiol in that form is not systemic. You can use both because you want the systemic effect. You want the first pass effect to have brain protection, cardiovascular protection, bone density, bone protection. Very important. Now let's go with his reference to stroke. Listen, you're not going to get in a car accident if you never get into a car. That's transdermal. Transdermal is not going to cause a stroke. You're right, because there's no hepatic effect. So it makes no sense what he's saying. I shouldn't laugh. It just shows that he doesn't have that clinical nuance that is so necessary. Transdermal isn't going to increase or decrease or have any effect whatsoever on stroke risk. But neither is oral micronized estradiol. That risk that he's talking about is coming with estrogen, oral estrogen. That's conjugated equine estrogens, not oral estradiol. It's going to reduce the plaque, where plaque rupture causes the stroke. There's not going to be any. It's going to cause plaque regression. It's going to prevent it. It's really important to understand who is the person you're getting your information from. Are they in clinical practice? Whether they're prescribing or overseeing cases, I don't care if they have the training, they have the knowledge, they have the awareness of the nuances, they have the clinical expertise. This guy does not. He's got some great information. He's trying really hard to be relevant in the menopause space, and I applaud him for that. However, the information he's putting out is, well, in this case, 3 truths and a lie.